Hello everyone, my name is Dr. Ferox, and today I thought I'd talk to you about how to choose the timing of euthanasia, because it is one of the most difficult decisions you'll ever have to make if you own a pet, and the fact is that you're going to be heartbroken either way. The other fact is that if you're faced with this decision, it doesn't really matter what you choose, that pet is going to die one way or another. Unless you exclusively keep cockatoos and Galapagos tortoises, you are going to outlive basically all of your pets. That's really the downside of pet ownership. But we still have the option and the responsibility to make the best decisions we can for them, even if it breaks our hearts. Timing will often depend upon the reason for euthanasia. Chronic illnesses are often very predictable in how they progress, while trauma is typically unexpected, and occasionally decisions are made for you. In Australia, veterinarians can choose to euthanize an animal without the owner's consent under the Prevention of Cruelty to Animals Act, but it's done very, very rarely, and usually it's in a case where you have a stray animal and no owner to be found, if it's been hit by a car, for example. While we can use this power, we tend not to, because you will have to justify yourself to the vet board and probably trial by social media. For most pets, they typically have a slower, meandering path towards the end of their life, which means picking the point where they're just starting to go downhill instead of hitting rock bottom is a little bit trickier. Occasionally, I will need to push a client to make a very rapid choice, such in the event of a gastric dilatation volvulus or an abdominal tumor which is actively bleeding. In these situations, I really do need the client to choose between emergency surgery now or euthanasia to prevent the suffering that we know is coming. And this news often hits those clients like a train. There's not really a nice way to do it because they are not in a nice situation. But there are verbal techniques that I use to try and soften that blow a little bit while also guiding them to a decision. Most clients are not being stubborn or obstinate, they're just in shock from the terrible thing that is happening to their beloved pet, and they do need some hand-holding to get to a decision. But for most pets, we have a much more gentle, planned end of life, although situations can change, so we are prepared to change that plan at a moment's notice. It is important to tell your veterinarian what you see at home, because your pet's behavior will be different in the clinic when they're full of adrenaline and they've been in the car, compared to what they are like at home when they're relaxed. In the clinic, they often mask symptoms or will appear more anxious, while at home, that's what they're like every day. That's what's more relevant. My philosophy is that I am trying to catch these pets when they are heading downhill, not when they hit rock bottom. At rock bottom, they are already suffering, and the aim of any treatment or euthanasia is to minimize that suffering, which is why it's important to talk early, because at the early stages, it might just be extra pain relief or different medication. If you leave it too late, euthanasia is basically all I've got left. Signs that a pet obviously needs help include things like not eating. I'm not too worried if they don't drink as long as they are eating, because if they eat, they are capable of drinking, they just don't feel the need to, especially if they're eating a lot of canned or moist foods. If they cannot or will not walk, especially if they are weeing or pooing and not getting away from it. Pets that are soiling themselves, firstly, can be a welfare issue because feces and urine will scald skin, and in Australia you can definitely get maggots in there. But it's also against their nature. They just don't want to do that. If they don't know or if they can't do anything about it, something's really wrong. And thirdly, if they're in obvious pain, well, that much is obvious. But earlier than that, I'm looking at 3 other criteria. Is the pet aware of what's going on? Does it know where it is and what's happening? Does the pet care? Do they have opinions about what's going on? And does the pet try to act on those opinions? If you have an older dog that doesn't do very much, but does follow you from room to room to room because it knows where you are and it wants to be with you, and it can do that, they might be doing okay. If you have an elderly cat that does just seem to sleep all day, but every day seeks out affection from you, that might also be okay. It's quite probable that they need a little bit of help with arthritis or whatever other conditions they've got going on. But age on its own is not a reason for euthanasia. And there's lots of other things we can do to help with many conditions. Another thing some people do is they write a list of that animal's 5 favourite things to do, whether that is going for a walk or playing games or eating or cuddles or the favourite sunbeam. And when that animal is no longer able to do 3 of them, while they're not at the worst they could be at the moment, they are well on the way, and they're no longer living the sort of life that that animal would want to live. So it's either time for a serious talk, see what else you can do to help them achieve their favourite things, or euthanasia. Really, we're looking for animals that are thriving, not just surviving. Because while we can extend life, why? It has to be a good life. We have to look for that quality of life. Otherwise, we're doing it just for us and not for that animal that you love. If you talk to elderly or chronically ill humans, a lot of them will say they wish they had an option for euthanasia, that what we do for animals is kinder than what we do for a lot of humans. The human issue is complicated and I don't intend to talk about it, but it is worth listening to people who have stakes in that game. The choices we make for animals are to be kind, because death is not the enemy. Death will come for all of us, for them, for me, everybody, one day or other. Death is relief in many cases. It's certainly not the enemy, but suffering is. Everything we do in veterinary medicine is to reduce suffering. And in this case, with euthanasia, we can choose to break our own hearts. We can choose to suffer so that they don't have to.